Hello and welcome. Today, we're diving deep into a critical aspect of kidney health: drug-induced nephropathy, or DIN. This condition occurs when medications intended to heal or help, unfortunately, damage the kidneys. Understanding DIN is vital for both healthcare professionals and individuals taking medications, as early detection and intervention can significantly improve outcomes. So, let's explore what DIN is all about. So, what causes this medication-related kidney trouble? The etiology of drug-induced nephropathy is quite broad, implicating a multitude of medications. Some common culprits include nonsteroidal anti-inflammatory drugs, or NSAIDs, which are often used for pain relief. Certain antibiotics, like aminoglycosides and vancomycin, can also be nephrotoxic. Chemotherapy drugs, often vital for cancer treatment, may damage the kidneys as a side effect. Contrast dyes used in imaging procedures are another potential offender. And finally, even some seemingly benign over-the-counter medications can contribute to DIN when taken in excessive amounts or in combination with other drugs. It is important to remember that individual susceptibility varies, making it difficult to predict who will develop DIN based on medication alone. Now, let's understand how these drugs harm the kidneys. The pathophysiology of drug-induced nephropathy is complex and depends on the specific medication involved. However, some common mechanisms include direct tubular toxicity, where the drug directly damages the kidney tubules responsible for filtering waste. Another mechanism is allergic interstitial nephritis, where the drug triggers an immune response that causes inflammation within the kidney tissue. Some drugs can also cause crystal formation within the kidneys, leading to obstruction and damage. And finally, medications can disrupt blood flow to the kidneys, causing ischemic injury. The end result, regardless of the specific mechanism, is impaired kidney function. Let's talk about how common it is. The epidemiology of drug-induced nephropathy is difficult to pinpoint precisely. It's estimated that DIN accounts for a significant percentage of acute kidney injury cases, especially in hospitalized patients. The incidence varies depending on the population studied, the medications used, and the diagnostic criteria applied. People with pre-existing kidney disease, diabetes, and heart failure are at higher risk of developing DIN. Similarly, older adults are more susceptible due to age-related changes in kidney function and increased medication use. The widespread use of potentially nephrotoxic medications, particularly in an aging population with multiple comorbidities, makes DIN a growing concern. What are the signs and symptoms that something is wrong? The clinical presentation of drug-induced nephropathy can vary depending on the severity and type of kidney damage. Some individuals may experience no noticeable symptoms in the early stages. However, as kidney function declines, symptoms can include decreased urine output, swelling in the legs, ankles, and feet, fatigue, nausea, loss of appetite, and shortness of breath. In more severe cases, confusion, seizures, and coma can occur. It's important to note that these symptoms are not specific to DIN and can be caused by other kidney diseases or medical conditions. Therefore, a thorough medical evaluation is necessary to determine the underlying cause. How do doctors diagnose drug-induced nephropathy? Diagnosing DIN can be challenging, as there is no single definitive test. The diagnosis is typically based on a combination of factors, including a detailed medical history, a review of medications, physical examination, and laboratory tests. Blood tests such as serum creatinine and blood urea nitrogen are used to assess kidney function. Urinalysis can detect abnormalities like protein or blood in the urine. In some cases, a kidney biopsy may be necessary to confirm the diagnosis and determine the extent of kidney damage. The timing of the onset of kidney injury in relation to the initiation of the medication is a key factor in suspecting DIN. While there aren't rigid classifications like other kidney diseases, we can categorize DIN by the specific mechanism of injury or the location within the kidney that is affected. For instance, we can describe it as acute tubular necrosis, acute interstitial nephritis, glomerulopathy, or obstructive nephropathy, based on the specific structure and type of damage. This classification helps guide treatment and predict prognosis. The cornerstone of drug-induced nephropathy management is to immediately stop the offending medication. Supportive care, such as fluid management and electrolyte balance, is also crucial. In some cases, dialysis may be necessary to temporarily replace kidney function while the kidneys recover. If allergic interstitial nephritis is suspected, corticosteroids may be used to reduce inflammation. The overall goal is to minimize further kidney damage and allow the kidneys to heal as much as possible. Management of underlying conditions like hypertension or diabetes is also important for long-term kidney health. Prevention is always better than cure, especially when it comes to drug-induced nephropathy. Healthcare providers should carefully review a patient's medication list, assess their risk factors for kidney disease, and consider alternative medications with lower nephrotoxic potential. When using potentially nephrotoxic medications, monitoring kidney function regularly is crucial. Patients should also be educated about the potential risks and symptoms of DN and instructed to report any concerning changes to their healthcare provider promptly. Maintaining adequate hydration is important, especially when taking medications that can affect kidney function. And remember, always consult with your doctor or pharmacist before taking any new medication or supplement. What can we expect in the long run, and what's on the horizon in this field? The prognosis of drug-induced nephropathy varies depending on the severity of the kidney damage, the underlying health of the individual, and the promptness of treatment. In many cases, kidney function recovers after the offending medication is discontinued. However, some individuals may experience persistent kidney damage or progress to chronic kidney disease. Ongoing research is focused on identifying new biomarkers for early detection of DN, developing safer medications, and exploring novel therapeutic strategies to protect the kidneys from drug-induced injury. The development of more targeted therapies and personalized approaches to medication management hold promise for improving outcomes in patients with drug-induced nephropathy. We hope this comprehensive overview has been helpful. Thank you for watching.